Welcome to Black Women's Health, which is a podcast and a platform where we promote and we are invested in the health and healing of Black women. And I have a very special guest today, and she has a very special message for us, given that it's October and Breast Cancer Awareness Month. I'd like to welcome to Black Women's Health, Reverend Tammy.
Hi, thank you so very much for having me today. I am Tammy Denise. I am a soon to be 20-year breast cancer survivor. I am a mom of three incredible human beings, and I get to be the grandmom of um, two grandloves. I have a 15-year-old grandson and a 2-year-old granddaughter. So I just am in bliss and
Nice,
joy.
nice, nice.
And beyond all of that, I strive very hard to be a woman of faith who walks and breathes and lives out an example of who I believe God to be. And I believe God is a bigger God that is big enough to hold us all, no matter where we meet God. Um, Being a world traveler, I've had the privilege to meet people in various spaces in their faith walk. And what that looks like can be very different. But nonetheless, the message of love, the message of hope, the message of healing stands firm when I encounter other people of faith who might call God something different than what I call God. Yeah, I am an ordained clergy woman. I do have two seminary degrees. So I speak from a position of being educated and trained and learning to do a deep dive into the scriptures, which is where I found which is where I built my foundation. I grew up in the Baptist church initially, then I transitioned over into the African Methodist Episcopal Church, AME Church, which is where I was trained and ordained as a minister. So I come to this just having experienced life. And there are some people who call themselves Christian who don't align with my understanding or my belief in the Christ that I follow. I get the privilege of trying to live out what I call the gospel message in my everyday actions.
Day to
And
day.
I'm human,
Cool.
fail daily, I fall short daily,
Yes.
but I strive to be that example that God wants me to be, and what I believe God has called many of us to be, to bring others into a belief that God is bigger and big enough. Correct. I am not the senior pastor, but I am on our ministerial staff.
You also said something in your introduction that you were a 20-year survivor of breast
Correct.
cancer.
That is true.
So I'm wondering if you can go back in time
Yeah.
and tell us about how the diagnosis was made and where your mindset was at
Yeah.
that time.
Oh man. How long is this podcast? To go back 20 years
It's
is
a long time.
it's a long time, but if I go back 20 years to summarize it, I was 39 years old. I didn't know much about breast cancer. Even worse, I didn't know anything about my family history of breast cancer. Um, and so the closest experience that I had was a woman at church who had been diagnosed with breast cancer. And she was pretty vocal about being diagnosed with breast cancer, but I didn't know what that meant. And one day at our church, there's some back stairs, and she was sitting on these back stairs, and she was weeping. And I sat down next to her and I asked her, if she was okay and if there was anything she wanted to talk about or pray about. And, she said, I'm starting to lose my hair. And I, I couldn't fathom it. Like this hair right now is boosted hair, but at that time I had natural hair that was this big and this voluminous. Um, so she said that she was getting ready to lose her hair, and so in my ignorance, I said, "It's just hair; it'll grow back." And she looked at me and she sat up very sternly and she said, well, that's easy for you to say with a head full of hair like that, and you're not being jeopardized of losing your hair. And I was like, whoa, that hit me like a ton of bricks. The next Sunday, well, that following week, I went to the barber and I cut all my hair off.
Oh,
It was shorter than yours.
oh.
I went from all of this, you know, to just a buzz cut. And I
And why
said,
did you do that?
because I wanted to support her. I wanted her to know that while I had no clue what she was talking about,
That's nice.
I wanted to be in solidarity that healing and hope was available to her. And that was again in my ignorance. 1 year later, I was diagnosed with breast cancer. By that point, I had decided to keep my hair short. And so it was about the length of yours in its natural state. But so then when I was diagnosed with breast cancer and when it got to the moment that I started to lose my hair, all of this came rushing back to me.
Wow.
And I always try to start my story there because many of us meet breast cancer or hear about breast cancer for the first time, even if we have a family history. Like myself, I have a significant family history of breast cancer, but I didn't know about it at the time because we don't talk about it. We don't talk about those things very openly and very freely. 20 years ago, it was starting to become this thing. You would see races around the nation and women crossing the finish line, raising their arms as survivors. And so I wanted to understand this disease. My doctor told me that I wouldn't live 5 years
Oh,
uh, to that coveted 5 year mark. I had an aggressive cancer. It had already spread. They were concerned
oh.
about whether or not they would be able to contain the cancer, as it had, it was just moving very rapidly through my body. And
If it's not too personal, how
mhm.
was the cancer diagnosed? Did you feel
Yeah,
something?
no. So I actually started having very heavy menstrual cycles. And I was having 2 and 3 menstrual cycles a month that would last, a full 7 days. So 2 to 3 weeks a month, I was having these
Not normal.
cycles. And
Yeah.
I was just depleted to the point that my blood count was, my hemoglobin count was five,
Oh,
five. And
severely
so
anemic. Yes.
severely anemic. In fact, I had to have 2 blood transfusions before I could have my first surgery because I didn't have enough blood supply in my body to be able to lose the blood during surgery. So it was just like a whole fiasco. So at any rate, we couldn't find the culprit. And so my doctor said, "You're 39, you'll be 40 on your next birthday. I'll write the insurance company to approve for you to have a mammogram." And that's how we found it on a mammogram. But it was no, I didn't have any breast issues that I knew of.
Interesting.
Yeah,
So,
I didn't feel a lump or
no
anything.
symptoms.
No, 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 no,
Was
nothing.
it a large mass
There were
or
multiple, and they were small. They were close to my chest wall, and I had large breasts, so I was never going to feel them, even if the masses or lumps, as I call them, were large. They weren't. They were the largest one was the size of a pea, but there were multiple, and so they had already spread into my lymph nodes under my arm. So yeah, yeah.
so, given your young age at the time of diagnosis, did you have what's commonly called triple negative breast cancer?
No, I did not. I had invasive ductal carcinoma or IDC. And so I'm glad you brought that up because doing this work and for people, the general public, what has happened with breast cancer and Black women specifically is triple negative is often seen as the breast cancer of Black women. I want to dispel a couple of myths. One, any woman can be diagnosed with triple negative. And I'm not sure that Black women are diagnosed the most of triple negative, but we have the poorest outcomes with triple negative disease, and we have the highest recurrence rate of triple negative. So if a person is diagnosed with triple negative breast cancer, they have a higher chance of the cancer returning after they've completed their course of treatment. I don't want to minimize anybody's type of cancer because all of it's egregious and none of us want any of it. Let's just acknowledge that. But I do want to say that as if we are going to educate people to know that there are multiple forms of breast cancer and Black women get all of them, from triple negative to invasive ductal carcinoma, to it's called DCIS. It's called I don't want to get into all of the medical and technical terms of it, but there are multiple forms of breast cancer. So if I don't say anything else in this conversation, especially to Black women, I want you to know that there are more forms of breast cancer than just triple negative. And there are women who survive triple negative breast cancer. Triple negative is touted as this big gloom and doom, and it's bad. It is bad. I'm not minimizing that at all. And at the same time, women survive triple negative breast cancer, and Black women actually are diagnosed with other types of cancer as well.
That's true. If we could go back to your story, so
Yeah.
the clarification, the abnormal bleeding wasn't due to the breast cancer.
That's what they have decided, that they were not
They were
connected at
not
all.
connected, and so
No.
this breast cancer was an incidental finding in the evaluation of the abnormal bleeding. Is that correct?
Correct. That is 100% correct. Yes.
So what was the next step? They saw this
Oh,
on
wow.
the mammogram.
Yeah. Oh,
Overwhelmed.
wow.
Do you remember your feelings?
Absolutely. You don't forget it. It's almost like having a child. I don't know if you have children or not,
I do.
but your children, my children are in their mid and late 30s. So, I can go back 38 years ago and tell you exactly what happened during childbirth for all three of them, right? And that's the same for me.
Wow.
I could tell you, I can smell,
Wow.
you know, what it felt like, what was happening. I have all five senses happening. My story was not a pleasant story. I had a Black female doctor. She called me while I was driving. My children were in the car. She asked if it was a good time to talk about, the results of my mammogram. And again, total ignorance. But I had my kids in the car and I was like, no, this isn't a good time. Can I call you when I get stationary and my children aren't around? She goes, oh, this will be quick. It won't take
Oh,
a moment. And
oh,
not only does she tell me, she laughs.
she laughed.
She laughed and she said, are you there? She goes, I bet you probably weren't expecting me to say that. And so then that was the last time she was my doctor. She was fired in that moment. But,
That was a
and
good choice.
yeah. And so going back, I have to extend grace to her because as a primary care physician, I'm not sure that she's the person that delivers the news to a patient that's been diagnosed with cancer anyway. Yes, she should have had a better bedside manner, or should she? Yes, I would have liked her to have had better bedside manner. But I think it started me on the path to get to where I am today to do this work, to say that if
Okay.
I'm going to survive,
Okay.
if I've got to be my own best advocate. What I knew was that I didn't like how I felt after that conversation. So
Yes.
I knew that I wasn't going to go forward with her because the trust had been broken. And
Yes.
then when I get to my oncologist,
Oh,
uh,
before, let me stop you there
okay,
because
okay.
what I'm hearing is you made the wise decision that I need to find another primary care physician.
I didn't make that. I just knew she could not go any further with me. I didn't know what was happening. I
And
didn't know.
that's the point, because you're at
Yeah,
you've gotten this news.
yes,
It's devastating.
it's devastating.
And
She
the
tells me
question
I
is,
have to
what
have
do
a
you
surgery.
do next?
Correct. So she tells me you have to find a surgeon quickly because they say the report says that it's aggressive. That's what my pathology said. So, and I was like, again, I didn't know what any of this meant.
Oh, now this was based on the mammogram, or this was after you had
The
the
mammo-
biopsy?
this is the mammogram
This is the
because
mammogram report.
they had seen multiple lesions.
Okay. Okay.
Yeah,
And
yeah,
so the mammogram report was saying this looks like an aggressive cancer.
because it had already spread. They knew that it spread without the pathology. Yeah, because they saw multiple, right? So
Yeah, that's a lot of news to take in over the phone in a car
while driving,
while driving with three children. That's a lot.
that was a lot. So I didn't know. All she told me was she goes, and I said, well, what do I do next? And she said, you have to have surgery. You got to find a surgeon. Now, where do I find a surgeon? Where do I was all I knew was the woman at my church on the back steps who was weeping over losing her hair. That was all I knew. I journeyed with this woman for a year, but it was prayer. It was support. I didn't know what was happening in real her reality of navigating breast cancer treatment. So long story short, she tells me I have to find a surgeon. I ask her where. She looks up in their healthcare system and gives me a name of three surgeons and asks me to choose the name of the surgeon. And like, I'm going to give you fictitious names. One was like Dr. Jones, one is Dr. Smith, and the other one was Dr. Beneke. And I was like, Beneke, what kind of name is that? How do you spell that? She's like, Beneke. And I was like, okay, I'll choose that doctor. I couldn't have chosen a better surgeon. He was everything she wasn't. And I I have always had a Black female physician. From the time I was a child, I had a Black female physician in college, and in my mid 20s I had a Black female physician. I always had Black female physicians. I don't know how God lined that up because Black female physicians, 60 years ago, 50 years ago, 40 years ago were not that prevalent and easy to find as they are today, but I had them. And I had heard all the things from my family about white male doctors. Um, this happened to be a white male doctor, and he was brilliant. But again, I think it was because God was setting me up for the work that I'm going to do, and people will have all types of doctors. And
Oh,
it doesn't matter that that woman happened to be a Black woman, um, because that could have happened with any doctor.
yeah.
And the reverse could have happened with any doctor, right? And so the takeaway to all of that is having a healthy patient physician relationship with your
Yes.
doctor where you feel seen, heard, and valued to the point that you can have a relationship of trust and where you can have co-decision making that happens in your doctor's office.
Oh, this is really precious information. This
Mhm.
is really good. Let me first say I'm sorry that you had that experience. And it really doesn't matter that she was a Black female. It would have been a bad experience, irrespective of sex or ethnicity or
Yep,
race.
yep,
And I think for most of us, the experience has been that when you do find a Black female or a Black physician, that you're able to better relate But clearly, that isn't always true.
That's not always true, and I don't want to interject, but she was before that incident. She was a phenomenal physician. She still is a phenomenal physician. She was a phenomenal, I had had her for years. And that's
Interesting.
why when I said, when I could step back away from the moment, I have to extend grace to her to say she was doing something that she shouldn't have been asked to do in the first place.
Interesting. Well, she was the one that ordered the mammogram.
She is. She was. Yes, she was. And so for me, that goes into, don't get me on my soapbox about just the medical training process in and of itself that needs work, that needs to better equip the medical students so that once they become physicians,
Yeah.
they have a better arsenal to be able to serve as many types of patients that they will encounter.
So I
Research,
do. Go ahead.
I was just going to say this, research is lopsided, right? We are not represented in research very well. Other ethnic groups are not represented in research very well. Typically in research, it's white males, or if it's something female specific, it's white females. So doctors take their cues based on research. And if we are not represented in the data, then the data is actually faulty and lends itself toward one side of care, which is limited, extremely limited, because in this country specifically, it's a melting pot. We have a little bit of everybody in this country, and the data should reflect that. I'll stop there because I can get on
No,
all
no.
of this.
Before we go on, I do have
I
one
know.
follow-up question. Did you ever have a conversation with that doctor
I
after
have
the fact?
I have not. I have not.
All right, moving on. You
Yeah.
kind of gave the criteria for what's a good relationship when you talked about the breast surgeon.
Mhm.
You said that he involved you in the decision making. He took the time with you, and you felt as though you were getting the type of care you needed with this doctor.
Yes, and I'm not sure that I wasn't that aware then, and the reason I keep bringing that up is because when we meet people at Carrie's Touch, they're where I was 20 years ago, not as aware because we don't have good relationships and good experiences with doctors.
So you're saying you didn't know. You didn't
I
know he
didn't
was a
know.
good surgeon, bad surgeon. It was kind
I
of
didn't
he
know.
just kind of did eeny, meeny, miny, mo,
I did
and
eeny,
it
meeny, miny,
turned
mo.
out that he was exactly what you wanted. So the advice that you would give to someone
Yeah,
who is in that, what do I do now?
yeah,
How do I find a doctor? How do I know if he or she's a good doctor?
yeah,
What would
yeah.
you say?
Yeah, so if we talk about there's two tracks. Well, there's three tracks. If we talk about my track where my primary care physician was the person that delivered the news to me because she ordered the mammogram in the first place. Ask your primary care physician to help connect you with an oncologist. While the surgeon was the next step, the oncologist is the person that's going to help manage your cancer care. Even with the surgeon being my next step, my next doctor that came along, he told me this is a little bit out of order. You should have seen the oncologist first, so they can first just tell you what cancer is. Then they would prescribe a treatment plan, which would include surgery, and then I would go to the surgeon. So if you have, and I was going to say three tracks, I can condense that. If you have anyone other than an oncologist giving you the news, ask your doctor to connect you, with an oncologist, a cancer center, and that's if you want to go traditional Western medicine route. There's a lot of Black people that do not trust doctors, do not take medication, will declare that they're not ever going to do anything like chemotherapy. I was one of them.
Oh,
And when this surgeon said to me, "You've got an aggressive cancer, it has spread, and we've got to move quickly," he said, "We have to be as aggressive in treating the cancer as the cancer is in trying to take your life." I was 39, single mom, 3 children. I wanted to live. So wherever you are, I don't ever tell people you have to go my route. There are many people that choose a holistic route. But what I say to you, to anybody, you've got to get the cancer out of your body. And then how you navigate your treatment process after that, you can decide that. But if you don't get the cancer out of your body, it's going to continue to grow. And we don't know of anything yet that holistically will eradicate a cancer that's growing.
okay. Okay. All right.
We just don't know. I'm
So
not going to say that.
your story, it gets
Oh, it's
it
complex.
really, really very
It's complex.
interesting. You decided that even though I wasn't into medication and surgery, when I got this news, I knew that I wanted to get rid of the cancer. And because it had been described to me as something that was aggressive, I then chose to have the surgery. And you also got an oncologist along the way.
Well, again, I wasn't that smart. I appreciate you for giving me a lot of credit based on where I am 20 years later. But 20 years ago, I wasn't smart enough to say I want to get rid of the cancer. All I knew was that I had 3 children and I wanted to live. What that looked like, I didn't know. And this surgeon is the person that helped educate me. And then he sent me back to the oncologist, which is where you really should start. And so regardless of where you want to go have the conversation with the oncologist and then get a second opinion. Get a second opinion.
Did you
Despite
do that? Did you get a second opinion?
Absolutely. I did. I did. Because again, I didn't come from a place of trust. I felt like the woman that I had been journeying with for the past, I don't know, 5, 6, 7 years betrayed trust, betrayed medical trust. I didn't know anything. I didn't trust anybody. I just knew that I wanted to live. And it's funny that we're having this conversation because I'm an actress also, and we just closed our show on Sunday. And at the time of my diagnosis, I had just closed the show.
Wow.
And so all of this
Wow.
is happening in my brain, like connecting the
Oh,
dots right
oh
now. I'm
my.
like,
Oh
all of
my.
this, I was a single mom, I was acting, I had a full-time job, I was dating, I was in the best season of my life at that time. And here is something that somebody's telling me could kill me. I didn't understand what that meant. And then when I get to the oncologist, he comes out with all these statistics. So I'm really going to blow your hair back on this one. He comes out with all of these statistics, and then he says, "You actually qualify for a clinical trial." I said, "What's a clinical trial?" He roughly explains what a clinical trial is. It's research that helps us advance medicine. The one that you qualify for will look at premenopausal women and the effectiveness of a drug they call the Red Devil. That's how intense this drug is. The effectiveness of this drug on premenopausal women, whether you should take it every 14 days or every 21 days. So I did 6 months of treatment in this trial. And with the
Before your surgery, or this
No,
was
no, no. So it was surgery, then it was chemotherapy, then it was radiation, then it was a 5-year hormone replacement therapy because it turned out that the cancer I was diagnosed with was fed by estrogen. So to treat the cancer, they have to suppress the amount of estrogen production in my body. So yeah, that's a whole nother long story, but I met with a researcher to understand what this clinical trial was, right? Little Black folks say, I'm not going to be anybody's guinea pig. Oh no, I know what they did to the Tuskegee Airmen in the syphilis trial. Most folk don't even know that it was a syphilis trial. What they know is a group of Black men were given a placebo in a clinical trial that killed the Black men, right?
Right. Right. They actually had syphilis and they withheld treatment
Withheld
because they
treatment,
wanted to see the
right?
natural course of syphilis.
Right. They didn't withhold. Well, I want to say it two ways, just based on how people receive it. They, because when I hear withheld treatment, that means that they didn't get anything.
They didn't
They did
get,
get
there was
something. It
penicillin
was
was
a
available and would have been treatment for the syphilis,
correct.
and they were not given the medication.
Penicillin. So, with that history, with that knowledge, no matter where you meet the story,
Yeah,
many Black people don't choose to participate in clinical trials.
that's true.
And so it's time for us to educate us and say, as a result of that egregious atrocity, there are laws that have been put in place to minimize, there are bad apples in every profession, right? But to minimize that ever happening again, you have to sign papers. I'm a researcher. We do research with Carrie Touch does research with UCLA. I just had to go through my certification again to be able to conduct research saying that I will do no harm, that I will make sure that I protect the identity of the participants in our clinical trial in any way. I can't take a photograph. I can, a photograph with no names. Even when our writing, we had to use fake names. That's not the word I wanted to use, but fake names in our manuscripts that we have published in academic and medical journals to be able to protect the identity of the persons that have participated. So there are laws and safeguards in place now to help minimize that. But I say, do what we're doing now. Educate yourself, get informed, ask questions,
Ask questions.
ask questions.
So this is quite a journey. You have the surgery, you have the chemo, you have the radiation, and then you go for the next 5 years on a medication that decreases the estrogen in your body. So that's quite a journey.
Kind of. Kind of. So at the end of the 5 years with HRT, hormone replacement therapy, at that time, research showed that they were having better results with women who stayed on the HRT for 10 years instead of 5 years.
But when you're saying HRT, what are you talking about?
Hormone replacement therapy.
Given to a woman with breast cancer?
Yes. So there's different types of breast cancer. And depending on the type of breast cancer is what determines your treatment course.
So we have to be careful here because one of the concerns about breast cancer often is that the cancer has what's called estrogen receptors. And the estrogen basically feeds the cancer. And when you
Yep.
don't want to feed the cancer, then you give anti-estrogen medication.
That's the HRT. That's the
No,
hormone
well,
replacement.
so
Well, for breast cancer. I
right,
don't,
but I don't want women to think that estrogen would be given to a woman with
yeah.
breast cancer. It would be something to suppress, and often that's tamoxifen, or there are other medications that are anti-estrogen because you don't. So let me back up just a little bit more. When they evaluate the cancer, they evaluate the receptors.
Mhm.
And one of the receptors is an estrogen receptor. And if you have an estrogen receptor on your cancer, then you're a candidate for anti estrogen medication. The
which is
problem,
called HRT.
this was a very difficult point in our conversation. Hormone therapy for breast cancer patients was being called hormonal replacement therapy by my guest. My concern was that this would be confusing to women because hormonal replacement therapy is usually considered to be estrogen or estrogen and progesterone, which is given to menopausal women because their estrogen levels are low. Hormonal therapies are given to breast cancer patients when they have estrogen positive receptors, and essentially they are receiving anti estrogen medication to lower their estrogen levels. And so hormonal therapy is different, completely different from hormonal replacement therapy. In essence, we were agreeing that you need an anti estrogen type of therapy when you have an estrogen positive receptor breast cancer. We were calling it different things, which just shows that there is a need for greater education, greater communication, and a need for us to be clear on our terminology and what we are actually saying.
I took tamoxifen, I took Arimidex, I took Aromacin, and I took what was the final one I took? There was a fourth one. I say all of that to say that I did not do well with those drugs. And so every 18 months, I had to switch the drug. And where I was going with this is that at the 5-year mark, they were showing that they were having better results with women staying on these. And so I tried to go another 5 years, but I had such a poor quality of life because I was struggling so much because I'm suppressing estrogen. My body needs estrogen. I'm a woman, I need my bones, all of the things associated with wanting and needing estrogen in your body. So it's a tough decision to make. And I'm glad that we had our back and forth around this conversation, because for me, it's also a very important note that women should take into consideration when making their decision around their breast cancer journey. Because for me, we suppressed the estrogen for 5 years. I went another 18 months, but my quality of life was so poor. However, 3 years into this, I got what I call ick. It was precancerous. They weren't using the term precancerous 20 years ago, but they were just like, oh, there's a concern and we'll watch it. Who
In
watches
your breast? Are
on
we
my
talking
opposite breast?
your
Yes,
opposite breast? Oh
on
my.
the opposite breast. And so I said, who watches and waits for breast cancer to come? Right.
Right.
So I'm still menstruating and all of those things. And I made the decision to have a bilateral mastectomy and to have an oophorectomy. So the
Hmm.
premature removal of my ovaries.
I
So
am
I had
so
some
I
tough
am so
decisions.
happy to have this conversation with you, and I'm happy that it's in October, Breast Cancer Awareness Month, because there are so many aspects about your story
Yeah.
that need discussion.
For those out there listening, for
What a
those out there
story.
hearing the conversation, the robust conversation that we're having, my story is from 20 years ago.
Yeah.
Medicine
You
has
know,
advanced.
and you're right, there have been changes, but your story is universal
Oh,
in
absolutely.
in the sense
Sure.
that suddenly, or for many women, this is something that just kind of drops into their world, and they have to figure out
Absolutely.
what they want to do. And there's so
Absolutely.
many major decisions that have to
Yeah.
be made in what seems like a relatively short period of time. And to
Yeah.
your point,
Yes,
if
ma'am.
you don't know,
You don't know. Yeah.
it makes it even harder.
It makes it even harder. And even terms that, what I like about what's coming out of this discussion, even how terms are used, right?
Right,
You're a physician, you
right,
use HRT in a totally different way than
right,
my experience in the breast cancer world,
right,
right? We use
right.
term, but at the end of the day, it's really saying the same thing. It's that these drugs are used to suppress, well, at least in the breast, my understanding is in the breast cancer world, these are drugs that are used to suppress estrogen in your body for those women whose cancer was fed by estrogen. And I think in
Absolutely,
that we are
absolutely.
saying the
The
same
same
thing,
thing, right.
even if the terms get conflated based on where we show up in the world. And here's the beauty for me in this is that there are going to be some women that are going to be confused, and being able to hear this
That's the point.
conversation,
That's the
they
point.
will be able to get,
That's
oh, okay, well, I heard this in two different spaces. I really didn't know what they said, but it'll make them ask a question. At
right,
least, hopefully, it'll make
right.
them ask a question,
Which brings
right?
us, tell us about Carrie's touch.
Carrie Paget. So as we round the corner, based on all of this, I believe my journey, as I've said throughout this conversation, I believe my journey was destined by God for me to help women walk through their cancer journey. And I've had the privilege of doing that around the world. I co-founded Carrie's Touch with my late sister,
Mm.
as a result of my cancer journey. What we didn't know was 10 years later, she would be diagnosed with bladder cancer,
Oh,
that claimed her life. And interestingly, we built this organization to see, hear, and value Black women and Black women's experiences with cancer, breast primarily, but other cancers too. But she was a classic, strong Black woman that didn't want anybody in her business. She didn't take any of the advice that we co-created in this organization, that we, get to help women and men navigating their cancer journeys. And ultimately, I just think all of the stuff, being able to stand my ground with a physician and firing her, and then still having compassion for her, as a physician, because she's a human too. I think she did the best she could with what she had at that time. I think she would make a different choice today, or at least that's what I hope. And Carrie's Touch has built programs, from awareness and education. Like I said, we conduct research with UCLA. We have a mobile app, and our Android version of the app is being updated. But a semi-shameless plug on this app. This all has to do with the play we just ended. But if you hit the crown, download the Carrie's Touch app and hit the crown. There's two tools in there. One is called Take Control, and it's a self-assessment of your mental well-being, to find out whether or not you might need to go talk to somebody, because this is overwhelming. You have to make life-changing decisions
absolutely.
based on information that you just get at, you know, in a short period of time, and you don't even understand the lingo. You don't understand what the doctors are saying to you because you yourself are in shock. And I say oftentimes the first year is physical because you're doing all the treatment, you're doing surgery, you're doing chemotherapy, you're doing radiation, or whatever is happening in that first year to 18 months. But year two is a mental game, because most women say, I just want to get back to who I was before I started all of this. And the reality is you can never go back, because the person back there didn't have breast cancer or another type of cancer. And so we try to help encourage women to find life and hope and meaning and purpose in where we are now and what we hope to be available to us in the future, because we can't go back, and so that's the first piece. The other one is called Before You Go, and you might be interested in something like this as a physician. Medicare especially is just not as useful as we would like it to be. We've got a lot of people that we're grateful that Medicare exists, but the changes in Medicare and benefits and how you can even engage with your physician when you're in the doctor's office has changed. And so this tool helps you to keep your thoughts organized, keep, any side effects or symptoms that you've had. And this could be for anything. I do this with our seniors at our church. I say, hey, download the app, just disregard all the breast cancer stuff and use this. If you have an ache or if you have an adverse response to a medication, write it down in the journal that's in this app.
That's good.
Find out because we have a lot of different doctors, right? What doctor are you going to see? Why are you going to see this doctor? What is your expectation of the visit and what outcomes do you hope to have? And condense all of that. And what are your top 3 questions you want to ask your doctor? I said, your doctor has 15 minutes to hear your concerns, assess your concerns, present a treatment plan, and do that with care and concern and compassion. And their schedules are ridiculous these days, right? So I try to humanize the doctors as much as I try to empower the patients and say, if you can go in your doctor's office organized, you're going to help your doctor give you the best care that they can give you. Your goal isn't to go in and challenge your doctor and have a fight with your doctor. Your goal is to go and be in harmony with your doctor about your care. And so that's one of the things that we do on our app, which is our technology side. And then, of course, we provide support. We try to provide financial support to patients, as funds are available, because since COVID, the housing needs, the basic needs of just women trying to survive day-to-day life. And then you add a, traumatic experience like being diagnosed with breast cancer on top of that, and it becomes big and overwhelming, and our women pull out. Exactly. Take away from her resources, and then make her make the decision. This is the literal language that women use. They say, I can't afford to go through cancer because I can't live on, what's it called? Disability. I can't live, on a, temporary disability on a reduced paycheck. They're already struggling to make ends meet, and to have any money removed from their monthly income just puts them in a difficult spot. And what they choose is what they feel right now. They haven't felt the weight of the cancer that has advanced and, is causing further complications. They haven't felt that weight yet. What they know is that they've got hungry kids today. And
that's a good point. That's a good point.
yeah.
Something that often doesn't get highlighted enough.
Yeah. So, we are forever trying to raise funds because we get donations. We could go have a big old gala. We could get $100,000 for us to go have a gala and feed 500 people in the room and have special high paid, high powered people come as keynote folks. But if I try to get $100,000 to actually help women live, survive, think about thriving, no one pays for direct services like that. Yeah.
And so, what was the name of your app?
Carrie's Touch.
Carrie's Touch, and you can just go Android.
Or iPhone.
Okay.
It's on both. The Android, I saw this morning that it's apparently there's some kind of update happening, but just check back, download the app, check it out. There's all of these. Well, I've got the screen but it says, I was just diagnosed, and there's videos there. I need support. I need a moment. I need prayer. And we get people that send in prayer requests, and we have a team of folks that are dedicated to just praying for the women. And most of our prayer requests aren't about them with cancer, it's about their loved ones. And that just speaks to the heart and the compassion and the servitude of Black women. We always care for other people. And, part of our research is um, dismantling the strong Black woman, or the superwoman syndrome that says, I have to be all things to all people all the time while suffering alone in silence. It's the um, Sojourner Truth quote of, nobody heard her in the midnight hour when she was sharing her tears, and it was just her and God. That's, we talk about the midnight tears that so many women, especially Black women, we cry because we carry the weight of the world on our shoulders and the expectation of us to do it with excellence. And we have to look good, and we have to show up, and we got to be all of these things. It's so much pressure on us. And it leaves very little time for us to love and care for ourselves the way we care for others.
That's a good point.
Yeah.
Don't want to take up too much of your time. I know
Yeah.
we've already gone over, and I guess my last question,
Mhm.
if you were to encounter a 39-year-old woman today
Mm.
with breast cancer who is kind of throwing up her hands, not knowing, what do I do next? What would you say? What would you suggest?
I'm going to suggest some of the things that saved my life. And I say it that way because I don't want us to say it to, say that I'm the guru or the end all be all, because everybody's journey is different. But some of the things that saved my life, the first thing I did, I prayed. I sought God. I sought the prayers, in my faith tradition. It says, if you have concerns or troubles of any kind, go to the elders, have them lay hands on you and pray for you. So I prayed for myself. Then I went to the church and I had elders pray for me. This was actually even before the diagnosis happened. This was at mammogram stage, at the phone call that I had an abnormal mammogram. I prayed. Then I educated myself. Once I got the call from the doctor in the car, what I was uninformed. I was uninformed. I was unaware. I was uneducated about anything she had to say to me. So that's no ding against who I am. What it is an acknowledgement that we are going to have experiences in our lives that are going to require us to educate ourselves more so that we can make informed decisions and not have regrets after those decisions have been made. And then I would ask my primary care physician, or a lot of women get to their breast cancer diagnosis through their gynecologist, ask them, please connect me with who you would consider if you were diagnosed. Please connect me with an oncologist that you would consider if you were diagnosed with cancer. And then you got to interview your doctor like you go to an interview for a job, because everybody's not going to be a match. That's okay. Just know that you are empowered and you have rights to choose a different doctor. We don't have to stay in a bad situation and suffer.
That's true.
So pain is inevitable. Sometimes I believe suffering is optional. That's what I would do.
Thank you. Thank
Thank
you
you.
so, so much. I think this has been very informative.
Yes.
I think
Good.
your story is, wow, overwhelming.
Yeah.
Overwhelming.
And you just got a snippet of it.
Oh my. Oh
You
my.
just got a snippet of it.
but I like how you took a negative,
Yeah.
potential negative, and turned it into a positive, and that's Carrie's touch. So thank you for doing that.
Thank you so much for what you're doing. Thank you for this conversation and how you are educating your community and advocating that they not be confused, that they have a clear understanding around conversations, and that they not be put in harm's way. Thank you. Thank you for this conversation. I am
This was
grateful.
great. This was great.
Yeah.
Please keep up the good work, and thank you for participating in this podcast today.
Thank you so much.
Thank you. Goodbye.
Take care. Bye-bye.